A brief summary of the index you've seen now. This is an athlete. He needs a mouth guard. He has not a good occlusion. He have a crossbite here. And if I do a titan analysis to this patient, you can see that the red target about the masseter moves to the right and anterior area. The blue target moves to the left area and anterior. So we have in this area an overload in anterior part of the arch, and I am really worried about the overload in this area because I fear a creeping of the teeth. If I put him a mouth guard in his mouth, I can see I have a new situation of the muscular activity is improved, I'm sure, but just a little improved. I can see the green ring for the global symmetry is not bad and is better in this situation. The load is posterior, more in the center of the mouth. So I think this is better. It's not perfect, this situation, but I'm sure, for example, that posterior load can protect better the TMJ of the patient. I need to balance again this glint. Now let's look another situation, another case report. This is a strong saucer player in a saucer team of A series in Italy. We have problems because we have a creeping here on the teeth. You can see the creeping on the second molar lower on the right of the patient. He have pain on his patient, on his tooth. His tooth is, he has pain on his tooth. Also, he has some pain to the muscle. He greened the tooth, but also he greened and create a hole also on my splint. What's happening here? I am overload on this tooth? Yes. We studied it also on the field, in external ambient. Let's look at titan analysis. Yeah, we have a bad occlusion. Muscle show me this occlusion is overloaded in the posterior right area. So obviously I have a creeping on the tooth, but also I have a creeping of my splint. So I can tell to the patient that we have too much of load in this area. Right masseter work too much in this patient, and we have to look at the cause. We need a diagnosis. Why this patient has this asymmetry of contact? Why? Well, in this case, we have extra stomatognathid problem, neck problems, shoulder problem, posture problem that create an overload on the head and on the jaw. He needs osteopathic treatment and training and physiotherapy. And sometimes the titan can help me to avoid the risk of a mistake. In this case report, we have a patient who has spontaneous myogenic pain at the lifting muscle of the jaw, so masseter temporal, is exacerbated if she opened the mouth, if you pulp the mouth, and she has problems in the swallowing. It's important, this symptom, swallowing. She feels an instability of her occlusion. She is not comfortable. And she tells me, I'm not in comfort, I have pain, I can't swallow, and what is happened to me? Well, I look at the teeth and I see this crown with a creeping, with a chipping of the ceramic on the crown. And I can see also a problem to the gum. So I fear an overload in this area. is possible this overload create a muscular problems? Well, let's make a titan analysis. This is the report you can stamp for the patient. Titan analysis show me a good occlusion. Yes, it's true. You can see here the red index, the red percentage of the index, but they are just a little out of the correct range. The global index of this occlusion is 89%, so it's good. And I think this patient has not any problem of occlusion. Why? Why she have problems of swallowing, problem of muscular activity and pain? It's not a problem of occlusion. She don't need a splint. She made also RMN of TMJ, any problem to her TMJ. But if you look at her panoramic X-ray, you can see a problem of Eagle syndrome. The styloid ligament is calcified. This is the problem of this patient. So she don't need a splint. She needs surgery. If I had put her a splint, it was a mistake. The problem is not improved. She needs surgery. So thank you to Titan to help me to avoid a mistake, because the Titan exam showed me that this patient don't need a occlusal approach. She need general rehabilitation, surgery, other problem. So if you want to approach correctly the patient, you have to look at the global activity of the patient. Here we are working, for example, with osteopathies. Frequently we work with osteopathies. Another case report for a splint. We like the splint. I like so much to put the splint in the patient if they need a splint. Muscle pain, for example, in a basket player, is just stress. Well, the stress is important. Emotional situations are important, yeah. But the patient need also in emotional stress a perfect occlusion to somatize perfectly his stress and don't have pain to the muscle or overload on TNJ. This is the balance of the splint. It seems good with the occlusal paper with a 200 thickness, microns of thickness, and also with 65 microns of thickness. It seems not bad, just a little green here to control this lateral sided movement. That I think is a good splint. But let's control in the mouth. No good. My balance, I did this balance in a first moment just only with the occlusal paper. Well, the Titan show me my balance is no good. I have a red ring here in the global symmetry index, and my block of temporal and masseter is moves in the anterior part, so masseter don't work. I have a torsion, is not perfect. Okay, this is the occlusion of the patient, habitual usual intercuspation. You can see here. Well, the occlusion is no good, but my splint don't improve the balance of occlusion. So it's important to grind it with our cutter, very thin, and with a gun, and to control also with a sweet contact with the occlusal paper, where is the first contact, and then when I have balanced my splint, I control if I have improvement of the balance. Yes, now is enough good. It's not perfect, but the impact is now 65%. I have just a little inhibition, but here in my splint before the balance, I had a situation with total inhibition. Those muscles don't work. Here you can see they work. And the splint is more balanced. It's not perfect. Why? Why is it so difficult to balance this splint? Well, let's control also, let's check with a dynamic analysis with the chewing. This patient, when she chew on the right side, she use correctly the right muscle. But when she chew on the left side, she don't use the left muscle, but she use again the right muscle. So she have a bad dynamic chewing cycles. She need training. You can do a training with what you want. I use this instrument, Alifix, but you can use some elastodontic instrument to train the muscle, the chew of the muscle. What about the traumas, micro traumas? For Italian Society of Sport Dentistry is an important topic. There are not just the trauma of the teeth, as in this child. And you need a correct tool to protect, to prevent traumas. This girl has a dislocation of the tooth and a fracture of the alveolar bone. I had to control vitality and reduce the dislocation of the tooth with anesthesia, obviously. But then I made a splint, elastic splint for the tooth of the patient. But also the patient is an athlete. She don't want to stop her sport activity. She wants to ride. She wants to play with her team. So she immediately need a mouthguard to protect the tooth, but also my mouthguard I need that my mouthguard protect also muscular activity. So we control muscular activity with the occlusal paper, but also with the splint. It's interesting to see that the splint create a good occlusion. Is better the occlusion with the splint, with the mouthguard, than the occlusion of the patient. This is the occlusion of the patient, not good. It's not so easy to balance the soft material of the mouthguard. Usually I use the material of 80 short of strongness, of elasticity. And it's important also to check the position of the jaw and on the maxillar bone and the upper arch in relationship with the TMJ. You need to take a face bow, and sometimes it's possible you have in your clinic so many athletes. How to put, how to make a face bow relevation if you have so much of athletes? Well, I can show you a system to manage many facial bows. It's simple. You use not the stone to lock the system, to lock the facial bow, but the silicone, and then you can use the bases that is very expensive. In my clinic, I have not 10 or 20 bases for the facial bow. And now the basis is ready for a new facial bow, okay? As that, also I can check 10 or 15 athletes with only one basis or 2 or 3 bases. And if you you need also the facial bow if you want to prepare for the patient a splint for the disengaging and the inhibition of the clench of the tooth in EDH is perfect for EDH. This sort of splint needs a facial bow, and on the right side of the screen you can see the effect of inhibition of this splint if you touch only the anterior teeth. You can see here the report of the Titan show me the global impact of the patient, the global work of the muscle is amidal, 53%. Okay, so these muscles are inhibited and the headache disappear. This is my daughter and my wife to the sea. We hope to come back to the sea and to our hobbies in the future. In Milan, we are in lockdown. Well, mandibular trauma. This guy is an athlete who has a big mandibular anterior trauma. You can see here the effect of the trauma, and the maxillofacial surgeons have created a new a therapy for him, but we have a little problem because we have a slight unevenness of the lower margin of the mandibular body. This involves a slight under occlusion because the lower margin of the jaw is not perfectly overlapped, so he have not enough vertical dimension. And you can see in the center of the screen the white area in the condyle with the fat suppression of the resonance. This means we have compression of the TMJ and reabsorption. We have a Titan that show us that masseter don't work. They need just a little more vertical dimension to work. And the barycenter of the mouth is too much anterior. If you control the muscle during the chewing cycle, well, the muscles work correctly during the chewing. Yes, because during the chewing, I have the food in the mouth. So the muscle can work because the teeth can work with the food in the mouth, and the masseter can work. During the clench in intercuspation situation, the masseter don't work because the teeth don't touch enough. We need more vertical dimension. So the patient can chew, but he can't clench. And the temporomandibular joint is compressed. You can see the mouth of the patient here. And then facial bow and the splint. The splint, those pictures are taken by the same patient because we have got a lockdown. He cannot come in the clinic to control the effect of the splint. And so at his home, he made some picture with the telephone, okay, with his telephone, his mobile. But here you can see the difference into the two report, the splint before and after the balance with the cutters. And at the control, at the second check, you can see the balance is improved. This is the splint. Okay, the blue and the red colors, the blue colors for the static contact and the red colors to control the dynamic contact, lateral side guidance and anterior guidance is important. Here you can see to create just a little freedom of movement to the patient because is in how can I say in Italy we call this situation a lock for the jaw. Is too much closed in this intercuspation. She needs more space to the movement, and it's important also to remove all the red sign in the posterior area of the splint. This is correctly balanced, and the Titan show me the muscle like this situation. So my occlusion is correct also for the muscle. This is the clench analysis, but I told you before about this. It's important also to control, to check during the calibration of the tool, of the Titan. I do control if the result, the report of calibration is repeatable, if the calibration is ever the same. In this area of the screen, you can see 3 different calibration, 1, 2, 3, and the work of the muscle is different. This temporal muscle don't know how to work. So this patient need a training, because if I have not a good calibration, I risk to have a problem to execute correctly my exam. In this area here, you can see 4 calibration perfectly similar. So the patient can correctly calibrate the system. I choose one of them, and then I can apply my protocol. If I have a bad calibration, I ask the patient to do some training for 1 or 2 months to improve muscular activity and to have a good calibration, because it's good for a muscle. Soft material is good for training, but under control. You have to be careful to the chewing effect with soft splints that create, look at here, the impact. The impact of this patient using soft splint all the day, all the night, is 278%. So it's very, very improved. It's too much. This patient can creep your work with prosthetic treatment and his teeth. There is so much of literature and scientific papers that demonstrate that it's dangerous. And then we want to respect postural function also. With so much of instrument we can use, for example, a stabiliometric platform, you can use a visual instrument. Also, we can use an accelerometer, an inertial accelerometer, to control the power, for example, of the jump. This athlete is a social player, 40 years old, is very strong and weight. He's a bruxist. You can see here problem of anterior envelope. Here, this is topical occlusion that create an envelope and not freedom of movement. Problem of lateral guidance on the left side of the arch, and the precocity of contact on the third molar in the upper jaw, in the right upper jaw. This is the visit of the patient. You can see that we have to measure the maximal opening, anterior movement, lateral movement of the jaw. Okay, I go faster because we have not the time. We touch the muscle, the TMJ. Okay, and then we control also with the Fox plane the occlusion, the occlusal plane, and then we control if we have a problem of temporomandibular compression. Okay, now the patient clench, and you can see he can't clench the thin articular pepper. We record his occlusion with this instrument. Is an instrument to record occlusion with a light curing tool. You can see here the easy bite that we put in mouth, and then we cure with a light. It's more simple than a wax. This is the easy bite in mouth. And then we can control immediately the effect of the new position with the Titan. We use the wax, if you want, or the easy bite to mount the model in articulator. This is the splint. We control the lateral movement and the anterior movement of the splint. And then we control with the Titan if my splint is correctly balanced. Well, in this splint was not correctly balanced in a first time. Then, after the grinding of the point of contact, and also in the interior of the splint, there is a little tilting of the splint. We have got a good balance of the splint. This is not good. So, only if I make a Titan analysis, I can see that muscle don't like my occlusion. This is not good for the athlete. This is perfect. And sometimes we control and check also if I have some external extrastogmatognathic interference on my teeth and on my muscle. So we control if we have interference from the neck in extension and flexion of the neck, and also standing on. And the patient needs also a mouth guard for his sport activity. This mouth guard is well balanced. This is the situation. This is the mouth guard before the balance, and then after the balance, the numbers are correct. The power of the clench is improved. The left movement of the POC masseter is improved. The barycenter is correct now. So we have the red and blue target well positioned in the arch, not too much on the left or right side or anterior posterior side of the arch. This patient have some problem to chew with the mouth guard. Some athletes need to eat during the performance if it's endurance performance. Do it exist, the descending syndrome? Yes, it exists. It's not so easy to find the paper in literature, but there are. We published so much of papers in literature, and the splint and the mouth guard show us that the descending effect is correct, because the splint improved the body balance, improved the jump. You can see here the situation with this is the power of the jump without contact of the teeth. With contact of the teeth, bad power, a low power, and with the splint or the mouth guard is improved. So I am sure this occlusion creates an interference with descending effect. The comparison of the results show me this. Well, let's focus on Titan. This case report is interesting because this patient is not an athlete. She's a woman who needs prosthetic treatment. She has not correct course of the occlusion. She has not a correct plan of occlusion. His occlusion is bad, is not dramatic, but I'm sure that she don't have a good balance. She have a torsion and too much of power of load on the right side of the arch. She can chew correctly, but she has not a good balance of occlusion. This is my splint. It's very, very grinded, and you can see all those holes in the resin. But I want to join a perfect balance of the splint. It is 88% of symmetry is a good result for me. Then I need to mount the model in the same position of the splint, but the patient don't want that I cut the splint. She loves a splint, and she tell me, don't cut my splint, don't touch my splint, use another system. Well, can I put the splint on the model? Usually don't. In this case, yes, but this is not my patient, this is another person, okay? So what can I do? I can record the position of the jaw in relationship with maxillary area, in maxillary bone, with a scanning of the position of the jaw. Using the scanner, the intraoral scanner, we can record the position with the splint in mouth without to cut the splint, so the patient is happy. Ecco qua. And then we create some model in resin in the same position of the splint. Then we can mount the splint, mount the model in the articulator with a hybrid situation into plaster model and resin models to create a good waxing, diagnostic waxing, to create a stamp to put in the mouth of the patient, what? A functional mock-up. I need to go fast because the hour is ending. Our hour is ending. We put some resin in the stamp, you know how to do. And then we put the stamp in mouth. Usually the mock-up is standing mouth, but in this case, we need to remove it from the stamp and put in mouth. We balance it. And then we control with the occlusal paper if the mock-up with a new vertical dimension is balanced. I do this because with the splint, the patient is very, very comfortable. And then I need to control if my balance is perfect also for muscle. So I need the theta to control, and you can see here, if the situation of the mock-up on the left side of the screen, 85% of balance with poke and bar and torso perfectly set, is comfortable for the patient. Okay, I'm sure my mock-up is correct, so I can prepare an occlusal treatment plan for the patient to modify his occlusion. And you can see with this red ring with 60% of symmetry and a bad occlusion of the patient, a bad intercruspation. The load is all anterior with torsion to the left side of the patient, is not perfect. It's interesting also to see in the right side of the screen the comparison into the effect, the report of titan of the mock-up and of the splint of the patient. The mock-up is correct, but is very, very similar of the effect of the splint. So I am sure that the mounting of the model respects perfectly the balance of the patient. Well, we have not time to go away, so I can't show you other interesting but complex clinical cases to reorganize the occlusion of the patient. I just want to show you our work with the Frecce Tricolori, the fantastic aeronautic team of Italy. You know, I'm sure you know Frecce Tricolori in Italy. We made for them some clinical and instrumental analysis because they have a very, very power of clench. They have also emotional stimulation, so they need to have an occlusion very, very stable. You can see this exercise, very dangerous. Then you can see the emotion of the pilot when he go. Okay, look at his breath. He's very emotional, he's very stressed, so I'm sure he's clenching. When he clench, he can create an imbalance in his jaw, in his dental occlusion, muscle of the head. So it's very, very dangerous because then then he go to do some very, very difficult and dangerous exercises. So it's important is just think to his exercises, okay, to avoid a crash. Well, with the pilot, we applied some splint to stabilize jaw and head because the lateral G of the aeronautic pilot is very, very hard, 6, 7G lateral. Okay, they need to stabilize to balance occlusion to have a stable head, and the Titan is for us useful, very, very, very useful to be sure the muscle have a balanced action. This is a publication on this work. This is another pilot for helicopter, but it's the same concept, the same protocol. Now, the power is nothing without control. If you want to control something, you need to measure it, to check with numbers. And Titan can help us to check our occlusal activity, our occlusal therapy. So for me, it's very, very, very important to have a protection for the stomatognatic system, for TMJ, for the tooth, for the teeth, for the muscles, and for their physiological activity in a situation perfectly balanced, and the electromyography can help me to join this perfect balance. We need sufficient vertical size to protect TMJ, guidance correctly set to control the activity of the temporal muscle and of the movement of the jaw. And obviously, you need the general context perfectly in physiologic with functional and structural situation of the patient physiological, because you need the patient can compensate. If we compensate, we can come back to our hobbies. This is my wife on our bike on the Como Lake, and I hope at the end of this pandemic, I hope to meet you in person in your country that I love. Thank you to you to give me all this time to speak together. Thank you, Steve, for the invitation, and thank you, Valeria, to your fantastic organization. Valeria is the mother of this software, and she's a fantastic bioengineer that usually help and is very disposable to the users to help us to create also new protocol and innovate in our daily practice. Thank you. I hope my English was understandable.
Thank you so much, Dr. Nanussi. Your presentation is always amazing, so thank you so much. And I have a couple of questions. There's a lot of people that are writing that everything was really well explained, and they thank you. But I just want to focus a little bit on a question that I think is so interesting also for you. And they want to know how to train the muscle when patients have a bad calibration. So you do a training on that sense.
Yes. All right. Calibration is important, is the basis of the exam. So you record during the calibration the maximal activity, the best activity of the muscle. When you clench in intercuspation situation, you control if the intercuspation affect the activity of the muscle. If you don't have a repeatable recruitment of the muscle, you need the muscle make some training. What is the best training for muscle? To chew. Now we don't chew hard food. Our sons and daughters chew only soft food, so our muscles are not trained. But if you give to the patient something elastic material to chew, his muscle are trained, do a training. You need some week to have a good training for the muscle. I use so much of tools to do this, of device. I like more so much Alifix, that is just a little and cheap system to chew some thin silicone cuneo, come si dice? But you can use also other system. It's important they are in silicone, they are soft, but under control. You must control the activity of the muscle of your patient if he use a system, elastodontic system, okay? Because sometimes muscle work too much, you risk your patient coming clinic with enormous muscle, okay? Very, very trained, like a bodybuilder. Quindi make your attention. It's important to chew. To show some patient, I just tell him, please chew something hard bread, hard meat, verdure, come si dice verdure?
Vegetable.
Vegetables, okay? Because we don't eat hard food. This is not good for our physiological activity of the muscle. The problem of the breath during the sleep, we have apnea because muscle has not trained, so the jaw go back and you can't breathe. Okay.
Yeah. And they also ask you, are you using this routinely on your Olympic athletes?
Yes, we did some tests, some therapy on Olympic athletes. Has been a very, very, for example, interesting experience that I can't show you now. I hope to meet you again to show this with the athletes of the tiro volo.
Oh, let me check.
They shoot for the shooting to the disc. Okay, very, very interesting because when they shoot, well, I had to learn to shoot because I never shoot no one. So I had to take some lessons, and we seen that the shooter, they don't clench during the athletic activity. They position the fucile. I don't know to say the fucile.
Yeah, it's like the gun.
Yeah. And they open the mouth and they say how, and they shoot. Well, but when they wait for their competition, they are sitting down, stop here, they control other athletes, they make a good result, and they grind and clench because they are very, very stressed and very worried. They shoot to 100 discs, and usually they have a result of 98, 99, 100 perfect target. So they need a high percentage of result. So they are very stressed. So the splint for this athlete is not for the competition, is to wait the competition, to be not tired when is the moment to shoot perfectly 100 discs. Other experience sometimes, yes, with other teams, with the bow is possible, saucer, frequently, athletic. Next time I will show you something is interesting. Now I am the accelerometer. I can control also the performance. Is very useful because with the Titan we control the occlusal balance, and with the accelerometer we control the effect on the performance. I don't want to improve the performance. I want that my performance is not damaged by occlusion, damaged by occlusion.
And do you always test your mouth guard with Titan? So are you doing a test with Titan without and with the mouth guard on, or in a different way?
Me la ridici veloce in italiano? Ho capito, ma voglio
Se
essere
fai
sicuro.
test di tutti i tuoi bite o paradenti col Titan e se fai test comparativi senza il paradente e con il paradenti.
Ever, sempre, never without Titan for me, because if I apply a splint, for example, I need to be sure the splint is perfectly balanced also for the muscle, not only for the teeth. So it's important, it's essential. If I apply a mouth guard, I am worried because can I show you? Let's do a back step here for the mouth guard. Okay. This is my mouth guard. The mouth guard is a high thickness because I need protection. It can't be too much thin. Here you can see the patient try to pull out the mouth guard and he can't because the mouth guard is individualized. Okay, I need to control if the contact is perfect. But here you can see my mouth guard and the impact is 90%. I need my athlete use his muscle at the maximal power. This is not maximal power. I have a little inhibition. 90% is not 100%. It's not bad, this mouth guard, but it's not so perfectly comfortable. After the balance, you can see here in Italian, paradenti bilanciato, mouth guard balanced. You can see all the signs, all the percentage are black, so they are in the perfect target, and the impact is 134%. So the power of the patient is improved. His brain tells to his muscle, clench and go away. It's perfect. You can recruit. You have any inhibition. So this is very useful for the patient. Usually we control the effect of the mouth guard or the effect of the splint ever in relationship with the effect of occlusion. Here in the center of the screen, I can't see my arrow, but in the center of the screen, you can see the effect of occlusion, of intercuspation. Is not good, 68% of symmetry, with torsion to right side, with the POC masseter or with overload on the left side of the arch in the on the teeth of the patient, and overload on anterior side of the arch. So I control if intercuspation is correct. Is not correct. Perfect. So I try to correct occlusion with my mouth guard. So my mouth guard is improved. Is not just a protection for the teeth, but also is a protection for the muscle and for all the activity of the patient. Usually we control the occlusion of the patient, the intercuspation of the patient. Then we control the mouth guard after and before the balance with the cutters, or also the splint with before and after the balance. I usually ever control with Titan my occlusal activity on the mouth guard, on the splint, on the mock-up functional for post-routing treatment. We control also the effect of the aligners, invisible aligners. Frequently, we will find that invisible aligners are not balanced. Sometimes some patients need that I put some resin. Okay, I can show it to you now to balance the aligners.
Okay, thank you. And okay, no, they just thank you for the great presentation. I hope to see many more presentation in English about Titan. So I have to say that this is the first one, and our aim is exactly to create the same Titan Academy that we have in Italy. So our aim in future will be provided at least at the beginning one webinar per month in English and also in other language like in French. And our aim is exactly to create, as I said at the beginning, is to create a community in order to share all your experience, especially with doctors like Dr. Nannuzzi, that can share their master and their experience in using Titan, and also in using Titan and other devices. Because as you see, Dr. Nannuzzi also used different technology, and so that's the reason why I think these kind of presentation are so interesting. And if you want to get in touch with Dr. Nannuzzi, you can write me and I will send the request to Dr. Nannuzzi. If you want, we have also a Titan Study Club, a Titan Study group on Facebook. It's a closed group because usually our users share their clinical cases. So if you want to send us the request, we will accept, because we know that you were at this webinar. So thank you again, and thank you, Dr. Nannuzzi, for your amazing presentation. And I hope that that will be just the one for the American and also the all over the world presentation.
Thank you, friends. I stopped to share my video. Ok. Non riesco più. Thank you for your attention and for your time, and I hope really to meet you again by web or perhaps in person. Okay. Thank you, Valeria, for your help and your organization.
Thank you.